Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
I'm Dr. Venkat. I have done my MCH neurosurgery training from All India Institute of Medical Sciences, New Delhi. For 6 years, I was in Delhi. After that, I joined in Tirupati SWIMS as assistant professor, and then got promoted to associate professor. Currently, I am working now as a senior consultant in Apollo at Nellore, Andhra Pradesh. So I have done my FRCS training also from UK, Edinburgh.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Yeah, seizure, we would have heard it very commonly.
Yeah.
It's nothing but our brain is like an electrical power generator. So all the impulses from the brain travel through wires or nerves, which carry the electrical signals from the brain to the various
Yeah.
parts of our body. Like if we want to move our hand, the signal should come from the brain. It comes as a electrical impulse. In
Yeah.
seizure, what happens exactly is that the electrical activity becomes haphazard, or it's a bit disturbed. So there will be short circuit in the brain that will produce various abnormal movements in the body which are not under our control. For example, some person may just jerkily move their body if there is a seizure, or some people may just keep on staring without giving any response. Some people may just lose consciousness and fall down. So these are all the various types of seizures which happens basically due to abnormal electrical activity in the brain.
What is epilepsy?
Epilepsy is nothing but the tendency to develop seizure again and again. For example, we would have seen many of the children when they develop fever in childhood, maybe at 1 year age or a few months age, they would have got seizures during fever. So that is called febrile seizures. It is not epilepsy. Some people may have tendency to get seizures again and again and again. So as a dictum, it is told that if persons develop more than 2 episodes of seizures without any cause, then it is termed as epilepsy.
What are the different types of seizures and do they affect people differently?
So just as we have discussed now, there are various types of seizures. One type of seizure is called generalized seizure, and other type of seizure is called a focal seizure. In
Yeah.
generalized seizure, the entire body gets involved. The person
Yeah.
usually loses consciousness. They develop jerky movements of all the upper limbs and lower limbs, hands and legs. They may bite their tongue, and they may lose consciousness and lie down. So this is a type of generalized seizure. In some particular types of seizures, there will be generalized seizures. They just lose consciousness and fall down. In some type of generalized seizures, they will be just staring into vacant space without response. This is also a type of generalized seizures. Focal seizures is nothing but only one part of the hand will be moving continuously, and the patient will be able to see that it is moving, but it is not under his control. So this is a type of focal seizures. These are the broad categories of seizures.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Many of the times there may not be any identifiable cause for epilepsy, but it is a general rule that if there is any first seizure in adulthood has to be evaluated. For example, if a person is 25 years old, he developed seizures, then it has to be evaluated, and it could be by because of some reason which can be treated or cured. Like for example, a brain tumor pressing on some part of the important critical structures of the brain. So that type of seizure has a cause. That type of epilepsy is caused by a tumor. So if we remove the tumor, there is a high possibility that the patient will be cured of the epilepsy. Or some type of seizures, there may be abnormal blood clot in the brain which may be causing seizures. So these are all identifiable causes of seizures, but in more than 50% of the cases, we cannot identify the cause of seizures. So then that person will have to be controlled in using medications. Some type of epilepsy these days, if a patient is not getting controlled by medicines, we can identify by newer MRI techniques and other PET scan and other. We can identify abnormalities in the brain. Like for example, one part of the lobe of the brain is called temporal lobe. If
Yeah.
the temporal lobe has abnormal neurons, it forms like something called temporal sclerosis. That is an identifiable cause of epilepsy. Once we remove that part of abnormal brain, the patient can come back to normal life without any seizures. So there are few causes of seizures or epilepsy which can be identified and treated completely and cured also sometimes, whereas many of the seizures we can only be controlled.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Yeah, just as we have told, the common symptoms of seizures or epilepsy is like jerky movements of the body. That is the most common, easily identifiable. The patient may bite the tongue also. The patient may have frothing of mouth. The patient may have loss of consciousness. So this is a common type of seizure. And other type of seizures will be having a staring looks into the space. The patient will be just staring. So most often, children will be bought by the parents telling that he's just looking into me, he's not responding. So that is a type of seizure. Uh, could be a type of seizure. Another type of seizure is like the patients usually will have abnormal or strange feeling. So commonly they describe as घबराहट सा हो रही है हिंदी में. So the patient will have abnormal feeling sensation in the heart, or the patient may have increased heart rate. Some patients may just keep on wiping the nose. So this is a type of seizure. So various symptoms are there, and very common is jerky movements of the body or loss of consciousness.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
So traditionally, right from our age-old generation, from Mayan civilization, Harappan civilization, epilepsy patients are misunderstood. In every culture, they are told like some evil activity or evil has captured the person. So in Indians, some people may be telling, "Usko bhoot aa gaya." Yeah, they will be telling some devil has occupied the person. So these type of abnormal or strange myths come because we don't know the cause and we don't have any definitive treatment in olden days. Now present days we have got very good control of medications, and these myths are now proven that it is no longer true. So it is not a devil which is occupied the patient. It is not an abnormal havas aa gayi hai. So it is not those type of abnormalities which has occupied the patient. So it is a myth.
How does this stigma affect people with epilepsy?
So most often the patients are discriminated. So they will have social issues like if it is a child, the headmaster or the school teacher will tell the parents that your child is abnormal, so take him to a special school. This is a common complaint by many parents because their children are not taken or accepted by teachers. That is because the teachers are afraid he may develop seizure and he may fall down, and there may be liability for the school. So that is the one common stigma faced by children. Second type of stigma faced by people is during marriages. So as the child grows and comes to teenage, so person may not get alliances because they are afraid that he has got seizures. So there may be difficulty in getting married, and people even refuse to stay with them. Some people they don't play with this type of children. They say that you are abnormal, and they don't play with the children. So these are all the problems of society. Those for those persons suffering from epilepsy.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
So just as in any other medical problem, the commonest answer is stress. So if there is a stress, it affects every part of our body. So just as we have told, brain is an electrical organ, it generates electricity. So if the person becomes stressed, so the electrical activity of epilepsy patients even becomes excess. So if a person has too much stress, that may be because of lack of sleep. So if the patient suffers lack of sleep, or if the patient has not taken food properly, if the patient has emotional issues at home, if the person has some fights happening at home which is leading to stress, if there is financial problems. So these type of stressful activities can put load on the brain and that can increase the number of seizures. That is one. And another very common thing is driving. So nighttime if we drive, there will be flashes of light coming from opposite. So we have seen very commonly that people will be using high beams, or there may be frequent flashes of light in some type of movies. So epilepsy patients are prone to develop seizures if they travel at night times, or if they drive at night times, or if they see go to movies with so many flashes of light. So these are all some of the triggering factors of epilepsy or seizures.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
So we know that the cause of epilepsy or frequent seizures is stress. So we have to decrease the stress. How can we decrease the stress? By regular physical activity, by proper healthy diet, and by not missing sleep. So the persons of epilepsy even more are required to have 8 hours of sleep without disturbance. So missing sleep is one important factor for developing seizures, and missing tablets or missing medications. Most often we encounter people with again and again developing seizures because we would advise them to take medicines for a particular period of time. For example, 2 years. If the patient has head injury, we will advise to take medications for 2 years. For example, they miss the medication and they come back to emergency with seizures. So not missing medication is the most important thing. Taking a proper sleep is another important thing. Avoiding stress by maintaining healthy lifestyle like proper diet, proper exercise, maintaining good relations with the family member. These are all very simple things, but they can have profound impact in the quality of life.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
So a seizure is one thing which we cannot control. So sometimes parents may even tell the children, try to control. If they put stress on the children, they develop more seizures. So seizure is one thing which is not under our control. So what can we control? We can control the environment around us. For example, if a person has tendency to develop seizures, he should avoid working near places of dangerous places like kitchen. So working near kitchen where there is fire, where there is fire hazard, or where there is a possibility of burns from oils and all, this has to be avoided by epilepsy patients. Second thing, when they get up at night or when they are walking around the house, if there are some cords or abnormal sharp objects, it can they may injure themselves. And if possible, if the marble floor and all, tiles and all, if they can avoid and replace by soft carpet, even if they fall, they can prevent any head injuries or fractures. Other thing is sharp objects, like for example, poles of beds. So the bed edges has to be smooth and it has to be soft. We can pad it with simple modifications. So even if they fall down, they do not injure their head. They do not develop uh, fractures. And other important thing is swimming. So if they are going to swimming, it's important that they should have proper medication before going to swimming. And if they go for swimming, they should have somebody available. So we have frequently seen patients of epilepsy going for swimming alone, and they develop seizures during swimming, and they drown and they die. So it's important that you should inform somebody while going for swimming, and you should not skip the medication. So these are all the few modifications in life, and if possible, they can have a small card in their wallet, so that if anybody develops seizures, they can know that the person has seizures and they can give the medication. And very frequently, if the patient has a tendency to develop seizures again and again, we can advise a small spray. So it's a nasal spray. When they develop seizures, they can just put the spray in their nose. This all has to be taken under medical supervision. But a simple thing is, if you have seizures, no need to worry. It can be controlled. If we can identify the cause of seizure, it can very well be cured in many cases. If we cannot cure the epilepsy, we can at least control the seizures. While controlling the seizures, it is important that you should take these type of small adjustments in your life, so that even if you develop seizure during any part of your life, you don't injure yourself or your friends and surroundings.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yeah, thank you very much for providing me an opportunity to provide some healthcare advices for people who are needed. So I thank very much for giving me this wonderful opportunity.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.